is upper and lower body bed bath. I'll wash my hands, knock at the door. Hi, may I come in? Hi, I'm Cindy, your CNA today. May I check your ID band? Oh, I see your name is Fran Smith. What may I call you today? Hi, Fran. I'm just here to give you upper and lower body bed bath. Is that all right with you? Great, let me gather my supplies and I'll be right back. I'll check the brakes for to make sure that the bed is locked and it won't be moving around, and I will close the curtain for privacy, and I'll be right back. I'm going to get my supplies. Here I am. Hi, I'm back. Okay, so I'm going to put a barrier on the table. Remember, do not shake your linens. And there we go. Okay, so now I'll take my linen bag, put it on the bed, and I'm going to take everything out of the basin here. Okay. And I have 2 basins today. And I have a washcloth in each basin and soap in a basin to help remind me that it's soapy water. And I have checked the water temperature with my wrist. Since you cannot touch any of the bed controls with gloves on, I'll put the bed up to a good working height for me, my comfort and safety, okay, which is waist level. And now I am going to sanitize and put my gloves on. Okay. All right, Fran, if you don't mind, I'm just going to put a towel across her chest. Now we're going to start washing the eyes. Obviously, you're not going to use soap in the eye. So this is my rinse water, and I'm going to just start with the eye away from me, and I'm going to wash, and I'm going to wash. Did you notice how I changed sides with the washcloth so that you're not cross-contaminating? So wash here, get another side of the washcloth, and wash here, okay? And I'm going to put that back in to the clean water that I've checked with my wrist. Now, Fran, would you like soap on your face? Okay, she would. Go ahead and make a mitt. And I'm just going to wash. Wash everything behind the ears and her neck. And now I'm going to make a mitt. And I'm going to rinse. Behind the ears and the neck. Now I'm going to take a towel and pat dry. Pat, pat, pat. Correction. After I wash the eyes, I did not pat dry. You need to do that. So after I wash each eye, wash this eye, and then the eye closest to me, I'm going to pat dry. So let's go back and do that. I'm going to pat, 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 and get another part of the towel and pat, pat, pat. Okay? So we've done the face. Now I'm going to take this towel that's across her chest and put it underneath her arm. There we go. And make it look kind of nice. There, just like that. But make sure she's covered, okay? Now I'm going to start washing her arm. And I'm going to make a mitt, and I'm going to start at the shoulder, and I'm going to come all the way down. Come all the way down, wash in between the fingers, And I'm going to ask her, would you like me to soak your hand? She said no. Okay, there you go. Cover. Bring this a little closer to me. Now I'm going to rinse. Okay. And rinse. And correction, I would have gone underneath the arm the very last swipe. So after you rinse, remember to rinse underneath her arm. Cover. And now I'm going to pat dry. Pat, pat, pat all the way. She doesn't want me to soak her hand. And pat in between the fingers and pat, pat, pat. If the evaluator wants you to soak her hand, after you dry her, I would take the basin with the soapy water and soak her hand and then put it in the rinse water. That's exactly what I would do. I'm going to move you just a little bit closer to me, Fran. Okay. Now I'm going to wash the chest. Okay. So I'm going to wash the chest and the abdomen on the side away from me. So you're going to wash, and you want to lift the breast and check for redness. That's what you're going to tell the state. I'm lifting the breast, checking for redness. Wash, cover, and now rinse. Make a mitt. Wash, lift the breast, wash the abdomen, cover. Now I'm going to pat dry. Pat, lift the breast, make sure you pat and pat. Okay. And at this point, if the evaluator wanted you to do the other side, generally not, but if they wanted you to continue, what you would do is you would then do the chest and the arm last. So it's eyes, face, arm, chest, and abdomen. If they want you to continue, do the chest and abdomen next, and then the arm. So that's upper body bed bath. Now I'm just going to go right into lower body bed bath. It's the same introduction, the same supplies, but it is a different skill. But I'm just going to go right into it just to show you what to do. You'll obviously have your gloves on. So you'll take the towel and put it underneath the leg. If you get this skill, lower body bed bath. Put it underneath the leg. Of course, keep it covered. And you'll take the soapy water that I've checked with my wrist and keep her covered. Bend her leg. Okay? And you're going to wash from the hip to the knee. So wash from the hip to the knee and underneath. Okay? And cover her. Now you're going to get your rinse water that you've checked with your wrist and rinse. They want you to bend, make sure that her knee is bent though. And wash from the hip to the knee. Rinse, cover. Now you're going to pat dry. Okay. So you'll pat, 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 and underneath pat, cover, and now you're going to wash from the knee to the foot, knee to the ankle. Bend the knee, keep her thigh covered though. Just wash from the knee to the ankle. Okay, and cover, rinse, bend the knee, keep it covered, pat dry. actually, what I just did, I don't want you to cross-contaminate. When I dropped the washcloth in the rinse water, I took the washcloth into my other hand and put it in there. I don't want you to do that. I want you to just drop it. Okay, now we're going to pat dry. Pat, 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 all over, cover. Now I will wash her foot and wash in between the toes. Again, bend the knee, wash. Oops. Come on, friend. In between her toes. Oh, I did it again. Correction, I would not have done that. I would not have cross-contaminated. Okay. Wash the foot, underneath the foot, rinse in between the toes. Now I'm going to pat dry. And what do you think you ask? Would you like to soak your foot, Fran? Oh no? Okay. Pat, pat in between the toes. Okay. Now I'm going to take this towel out, put it in the linen bag. Just like on Upper Body Bed Bath, you would have taken the towel that was behind her arm and put it in the linen bag, and put the drying towel in the linen bag. Now I will take my gloves off, sanitize my hands, put your gloves in the garbage can, sanitize your hands, put the bed down to as low as it will go, give her her call light, straighten her out so she is comfortable and aligned, and make everything look neat and tidy. Okay. Now if there's nothing else that you need, oh, here you go, Fran. If there's nothing else that you need, I'll leave you. Here's your call light. Call me if you need me. I will open the curtain, wash my hands, record and report.